So hi everyone. As Sharon mentioned, I'm Katie. I'm the Wellbeing Programme Manager at Social Enterprise Kent. I just want to start off by saying thank you to Sharon and to ReferKent. It's really useful for us to be able to get the word out about our services and ultimately hopefully be able to support your clients as well. So yeah, hopefully this will be informative for you guys. And yeah, if you've got any questions, I can answer them at the end. So to start off with, I'm just going to go over a bit about what Social Enterprise does, then I'll go into detail about Connect Well East Kent, the wellbeing service, and also our social supermarket and our cost of living project. So Social Enterprise Kent's been around for about 35 years. As a VCSE organisation, we've been quite lucky and been able to be quite agile about the support that we offer the communities and their changing need. So what we do can sort of be split into two main pillars, so business and skills and health and wellbeing. So our trading arm of the organisation is our training department. We offer a huge range of training from mental health first aid to moving and handling to digital skills. Our training team are really great. Then in terms of business support, we've got free infrastructure support in East Kent and also social enterprise support in Thanet. If you've got any questions about that, I will do my best to answer at the end, and if not, give you the contact details of the relevant staff members. And then a project that sort of bridges the two is our social supermarket called SE Kitchen. I'll touch on that a bit more later on in the presentation. Then in terms of health and wellbeing, we obviously have the Connect Well East Kent service, the universal wellbeing. We've also got a health equalities project, which tries to build links between the VCSE sector and health. And we've also got the cost of living project, which I'll speak about later. So starting off with Connect Well East Kent, I should have mentioned this in the beginning. It is going to be a little bit interactive. I'm using a fancy new thing for me called Slido. If it doesn't work for you, you can pop your answers in the chat. It's just so it feels a little bit less like I'm talking to myself and there's a bit of interaction. So I hope that's okay. So the first question, no right or wrong answers. Have you used Connect Well East Kent before? This just sort of tells me how well I've been doing at my job of getting the word out about this, and also sort of how much granularity I need to go into about it. Hopefully by the end of the week, oh no, we're Friday, the end of next week, you'll all have been able to answer yes to this question. So I think you can scan the barcode and use your phone, or you can do the number at the bottom.
You are asking technology this time of day.
Yeah, we should have done some digital skills training at the start of
I
this.
know. Well, I'm recovering from COVID, so my brain is totally fogged. Will it be okay if I give you a verbal answer?
Yes, that's perfect.
Yes.
Good. Okay, I'm glad to hear it. That's the answer that I like.
Yeah.
Okay, so a bit of a mixed response. Some people have and some people haven't. So yeah, I'll go over everything, and if you've got any questions, if you've never used it before or something isn't clear, please just let me know and I can expand on it. So what is Connect Well? So it is a free, impartial advice service. The aim of it is to be sort of preventative. What we want to do is keep people well, independent in their homes, connected to their communities for as long as possible. It's looking at those sort of non-clinical determinants of health. We know that people who have poor housing, people who are lonely, people who aren't accessing all of the benefits that they need, we know that they have worse health outcomes. So we really just want to make sure the communities in East Kent are, thriving and staying well for as long as possible. So we're funded by the NHS and Kent County Council, and then our partners on the project are Carers Support East Kent, and we work with different Age UKs in East Kent as well. So Carers Support give the as it says on the tin, they give the help for carers as part of the contract, but all of the information for them can go through us, and we're sort of the central triage hub. So yeah, if you're referring anybody that you know as a carer, you can just let us know on the referral and we'll make sure that it gets through to them. So how does it work? We're obviously on the ReferKent network, so you can send through the information on there. We have a referral form, which I can send to you, or if not, we'll just ping it back once you send the referral through ReferKent. So what happens in the beginning is that the clients are called by our triage team. If it's just written down for sort of signposting support, so support with getting a lifeline or getting a cleaner in, then the triage team will support them with accessing that. They're very good at noticing if somebody needs a little bit of extra support and sort of asking those questions to find out what the client's needs are. So if they get the sense that a client is struggling or is overwhelmed, or if they aren't able to take down a number to call for a lifeline, then they'll always refer it through to a community navigator, and they can go out and visit them. So yeah, if they're referred through to the community navigator, they get up to 12 weeks of one-on-one support. The navigators can visit people in their homes. That's what normally happens, but they can also visit them out in the community or sort of whatever works best for the client. At the moment, we say there's about a 2-week wait to see a navigator, but the navigators will contact before to sort of arrange a date to go and see someone. As I'm sure a lot of people are finding at the moment, there are a lot more people that need sort of help and support. So if there is a longer waiting time for whatever reason, then we always advise the client when the triage team will. So we offer really a broad range of support, and I always say if we don't do it, we know somebody that does. We've got a great sort of established community knowledge, so we're able to signpost for things that we can't directly help with. The main thing that we support with at the moment, due to the sort of times we're living in, the cost of living crisis, is financial support. Most of the benefits that we can help with are for people who are over pensionable age. We can't help with PIP or DLA, unfortunately. Any benefit that affects other benefits, our navigators aren't trained to support with, basically. If you're not sure if we'll be able to support somebody, you can always give us a call or send through that referral through ReferKent, and one of the team will get back to you and sort of let you know if it's something that we're able to help with. We also do a lot of enablement support. Most of our navigators are trusted assessors, except some of the new stuff that we've got in that we'll train. So they're able to do aids and adaptations inside a house. So things like grab rails, perch stools, things like that, just sort of cuts out the wait time to wait for an OT. So that's something that we find that we help a lot with. So blue badges as well, but generally any kind of sort of form filling. You know, we know a lot of people, when they have a lifestyle change, there's suddenly a barrage of information coming through and it's very overwhelming. So the navigators are able to sort of come round and really like go through step by step how to fill these things out. So as I mentioned earlier, Carer Support East Kent offer a really brilliant service. They can offer respite support. They have a great hospital discharge programme. And also, if a carer is calling up with a sort of mental health crisis, they just need to sort of offload and, you know, they're upset and overwhelmed, then they're trained to help with that. So that those phone calls, the carers are given the hub phone call and it goes through to Carer Support. We can also help with getting on the housing register and sort of how to navigate that and making choices through that. So the 3 things with stars next to them are things that unfortunately are paid for services that we refer out into. So domestic support, if people want help with cleaning, a handyman, meal prep, anything like that, that's obviously a paid for service. We can't advise how much it will cost, but we let the client know that that there will be a cost attached to that. Social opportunities, so we hold the wellbeing contract, which I'll go into for Thanet in the South Kent coast. So some of the activities are free, but some of them are low cost or, you know, have a cost attached to them. So, and then signposting as well. So some of the services that we refer into, like lifelines, have a cost attached. So who can we help? The service is for over 55s, but as I mentioned, in terms of financial support, we can mostly help with people who are over pensionable age. We can also help with adults with complex needs. We define a complex need as anything that makes day-to-day life difficult. So yeah, again, if you're not sure if we're able to support somebody, just send us a message through ReferKent or give us a call and we can let you know if it's something we'll be able to support with. And if not, you know, we won't leave anyone you know, out in the cold, we'll know someone to refer them through, depending on where they are. So what areas do we cover? It's a bit of an interesting one. We cover the 5 districts of Thanet, Canterbury, Dover, Ashford and Folkestone and Hythe, and also just Faversham. So anybody in those areas we can support through this. Okay, so this sort of links into the Connect Well East Kent work quite well. Again, it's another preventative service which offers activities and events for over 55s and adults with complex needs. Again, the idea of it is to be quite preventative. So we find that people that come through our doors tend to score quite highly in terms of well-being, ONS scores and things like that. But the idea is that we give them access to be able to move, to be active, and also to make those real community links, because we know how much of an impact loneliness and isolation can have on people. So I'm sorry, we've got another interactive moment. So I found this shocking when I found out about it. So yeah, another part of these projects, I guess, is trying to take the pressure off health and statutory services. So how many doctor's appointments per day are thought to be due to loneliness?
You can put me as 25%.
Okay. So the correct answer is, well, according to the study that I read, it is 20%. So obviously that is a huge part of GP's time. And in the end, loneliness is a health issue because of the impact that it has on people's health. But, you know, if we're able to connect people, then it just has a great outcomes for everybody. And one of the things that I love about this contract is that lots of the feedback we get is people saying they enjoyed the activity, but also about them laughing. And I just think, you know, what a wonderful thing to be able to connect people with their communities, things they enjoy, and for them to ultimately have a laugh is brilliant. So, oops. I knew I was going to overshoot it at least once in this. So this is some of the activities that we offer. You know, it's sort of about challenging the perceptions of aging, giving people things to do that are genuinely interesting and things that, you know, people are excited about. So we've had an ice cream factory tour, there's seal watching tours, so those are things that are more one-off or occasional things, but we also have like new age curling, creative writing, coffee mornings. We do walking activities because we know that it's often difficult to engage men, so we're doing walking football, walking cricket. They've had climbing sessions. There's also a motorcycle meetup that's really popular. So yeah, it's sort of about listening to the community, seeing what they want and being able to put on things that like sound really good fun. I would love to do any of these things, to be honest. So where do we cover? So for this one, it is Thanet and the South Kent coast. So Thanet, Dover, Folkestone and Hythe. It's a bit of an odd area to try and fit on a slide, hence the sort of jaunty angle. So the target groups are the same as with Connect Well, so over 55s or adults with complex needs. And again, complex needs is just anything that makes day-to-day living a bit more difficult. So this is another interactive one. It's interesting for us to know if there's anything that you think is missing in terms of community support, events, activities. You know, we have things like sit fit and walk fit and things like that. Do you think it would be useful for your clients to see more of that? I'm putting you all on the spot, so you might not have any ideas, but if there's something that you're hearing from clients that they'd like to access, then it's good for us to know. It's hard on a Friday morning to think of ideas, I think, isn't it? But
if I was going to say, if you guys wanted to just pop it in the chat as well, you're more than welcome to.
Okay. So I'm going to talk about employment support in a second, so that's good. Yeah, we signpost out to befriending services, but we do hear a lot. There's a huge waiting list for befriending. There's a bit of a volunteer shortage at the moment, isn't there? But that's something that we can support through Connect Well East Kent. You can pop that on the referral and we'll look into that. We have gentle walking and gentle exercise across the patch, across Thanet and the South Kent coast. We have a list of activities. So if you want me to send that through to you, then you can send me your email, or my email's at the end of it. We've got some Christmas shopping trips coming up. So yeah, but more regular shopping trips is an interesting idea. I can speak to our providers about that. Yeah, befriending is the big one that's coming up. But yeah, if you need anyone, if any of your clients need a befriending service, you can refer them into us, and we can look into signposting for that. Brilliant, thank you. That's really interesting. I'm going to try and, I'm not sure how this Slido thing works. I'm going to try and remember all of your things. Oh, days out as well. They do days out across the patch as well, and sort of they try and do different things. So like the ice cream tour, they go and see a play or something like that. So yeah, that's something else that we can offer. Right, thank you. You've got some great ideas. So SE Kitchen is our social enterprise. Our social supermarket. Sorry, there's too many socials. So it's based in Ramsgate on Broad Street. Anybody can access it. It's now open 6 days a week, so it's open Monday to Saturday. We get 2 deliveries a week. The idea is that it offers healthy, very, very low cost food. Nobody's sort of turned away for lack of funds, and the team there are super friendly, really helpful, and again, very sort of well linked with the wider community. So if you're supporting anybody in Thanet or that can get to Ramsgate, do send them through to SE Kitchen. And they also have their own ReferKent page. So if you want them to get in touch with one of your clients or something like that, or you need some more information, you can contact them directly. So this is where the employment support is going to come in. So this is our new cost of living project that's sort of just kicking off now. So this is for anybody over 18 in East Kent. So it's a bit of a sort of a wider demographic than Connect Well and the Universal Wellbeing Contracts. So they can help with lots of different things. So employment support is going to be a big part of it. So we've got sort of trainers and connectors that can help people to find work. They can help with internet and digital skills. There's a grant for white goods. So if you know someone that needs an oven or a fridge or anything like that, you can refer them through to us for that. We're going to be doing healthy living support as well, housing, sort of some of the things that have a crossover with Connect Well. So yeah, it's really, again, those non-clinical determinants of helping people with that for any over 18s. So that's everything for that, I think. So my email address is on there, my phone number as well. If you forget to ask a question at the end of this, or you just want to follow up with me about something, my phone and my email address are always open. So please feel free to get in contact with me about anything. I think we're always better when we're working together. So hopefully we'll be able to support some of the people that you're working with. Thank you.
Brilliant. Thank you so much, Katie. That was really brilliant. What I'll do is I will just pop into the chat, as I've already popped in the chat for you guys to learn more about ReferKent. As Katie said, sorry, that everything that she's mentioned is on ReferKent at the moment. You're able to make a referral to them, and they'll be able to support you, support your client in those various areas. It will be a great, I think, the Connect Well East Kent and SE Kitchen. I keep wanting to say SEK Kitchen.
It's a bit of a mouthful.
SE Kitchen are really great projects, so we're really happy to promote them. What I'm going to do is just pop a little feedback form in the chat. If you guys are able to just fill this in, that would be really helpful. And let me know if you can't access anything, and I'll figure that out for us. No worries about joining late, Marie. We have just finished the presentation, but we will just be sending out the recording as well, separately. But yeah, so what we'll do now is hand over to a bit of question time. So we've had a couple of questions come through. First of all is from Mark, asking if clients get provide input on the ideas of social opportunities, or if it's a menu providing.
So yeah, we have an activity list that we update every quarter, but we're always looking for new ideas, and our lead providers are really good at sort of finding out what people want. So if, you know, somebody is desperate for a book club, say, they know that there's appetite for it, or even if they think they're not, they've just got an idea, they can definitely contact the lead providers, and they'll you know, they'll always try and set something up and see how it goes.
Brilliant. And we also have one from Chantel asking, what are the costs of Lifeline?
So I don't, because we refer out into the Lifeline service, I don't know what the cost is. It depends on what sort of package you want with it. So we're not able to advise on that, because we refer through to a couple of different ones as well. Trying to keep on top of the pricing is difficult, but yeah, sorry, I don't have an answer for that one.
No, that's right. And if there is the case that, you know, you can't always refer to us, refer to them, they can always forward on to someone else in ReferKent or whoever they're on their contact list as well. That it links very nicely over to Joanna's question, but if it's why it's specifically over for 55s.
So it's part of the adult social care budget from Kent County Council, and that is the target groups that the money is sort of ring fenced for. So that's why it's for over 55s. Yeah, it is difficult, because you might be helping somebody that's, you know, in their late 40s or early 50s, or they might want to join the activities. But yeah, again, if there is a complex need there, if there's sort of a mental health need, or yeah, or some kind of other form of disability, you can, they're eligible under the complex needs part of it. So
perfect. And like we say, if there is a situation in which that isn't suitable, you can always have a look through the list of organisations we have, because there are certain, if it's not specific, if it's not for over 55s, or if it's a different part of Kent, there will be something that will be on ReferKent. And if there isn't, we're on the hunt and we're growing our system as it goes. We are lucky enough to have over 100 organisations on the system at the minute, including the organisations from Social Enterprise Kent. So we're very happy. We're growing the system, and we're happy to have organisations that are going to hopefully provide everything that your clients need. Perfect. Does anyone else have any more questions? We've already got some good feedback through the form, so that's really great to see. Thank you, guys.
If anything does come up, I know sometimes I come away from these meetings and think, oh God, I could have asked that. Please just send me an email.
Yeah, of course.
Happy to take contact.
Yeah, we're happy to help. If there's anything that comes through as well, feel free to forward it to us, and we'll send it to us and we'll forward it over. But yeah, okay. What I'll do is I will end the session here. If anything does come through, please do let us know. Thank you all for coming along. Thank you, Katie, for presenting. It's much appreciated. I hope you all have a lovely Friday. Take care, everybody.
Thank you.
Thank you.